This is crazy. I remember when I first heard that there was a shortage, I was like, what?
Nearly a year ago, Kalamazoo couple Ashley McKinney and her husband were filled with joy when they welcomed a new addition to their family. But for McKinney, mixed in with her daily responsibilities as a mom, is physical pain. Lots of it.
It's been a little nerve-wracking just not knowing what's going on with my body and still having to pay these co-pays up front.
Ashley says she wasn't feeling quite right, so she went in for an ultrasound. Then came a surprise. She tells me that she was told it could take more than 80 days to get results.
It's just a waiting game. It flares up your anxiety.
Ashley has fibroids, but just how many and where they're located is a mystery. She's set to have an MRI, and those results could also take time. Ashley, though, is not alone.
So there's some days like I don't even want to get out of bed.
Tabitha Nash lives in Battle Creek and finds herself in a similar situation. Tabitha tells me she's dealt with fibroids too.
When you're in pain and you have so much to deal with at home, working on top of the pain, it almost gets to be never ending.
Tabitha says she has a family history of breast cancer, which is why she says getting a mammogram is so important. She got one in January, but did not get the results until 3 months later. Patients, though, are not the only ones feeling the impact.
When people can't do the work that they want to do for their patients, they are always frustrated. Doctors, nurses, patient care techs, even transport folks.
So what's the root of the problem? The Michigan Health and Hospital Association says the demand for imaging services is going up while the number of workers is going down. The MHA says they're seeing fewer students going to school for radiology.
People that have a trauma, an emergency, an urgency, that is all going to be the first thing that hospitals are doing, finding someone to read those images and get those results.
And that's what patients like Tabitha are hoping for. At the very least, a temporary solution.
They need to broaden who can read them, at least for temporary time. I know that in some states when we had COVID and we had insurance problems, they were letting non-licensed people look them over.
I reached out to Bronson and Ascension, two of the major hospital systems in West Michigan. I have not yet heard back from Ascension, but Bronson sending me a statement saying in part, "We regret that turnaround time for some test results is taking longer than expected for our patients. We have been working diligently to address this. We have been successful in securing additional radiology services to help meet the demand, which has improved turnaround time in some areas, and we anticipate improved service levels over the next couple of months." Now, as far as solutions, leaders with the MHA say they're working on getting more people trained. They also say it's important for you to be patient with radiologists and radiology technicians who are dealing with the shortage every day. Now, the latest data from the MHA shows there were 19,000 total job openings at Michigan hospitals in March, including 4,700 nursing jobs. Of course, we'll keep you updated on all of this. For now, in studio, Tyler Brummett, News Channel 3.
I'm Jessica Harthorn. Thanks for watching. If you like this video, there's plenty more to see. Just take a second and subscribe to our channel.